I see patients that predominantly have seizure disorders. These are called patients with epilepsy. I also see patients with brain cancer and a wide variety of other neurosurgical conditions involving the brain and the spinal cord. I establish a relationship with my patients such that we are partners. Together, we map a pathway to get them back to a state of health and maximize their quality of life. Much of this pathway involves simple education and support and counseling. Sometimes the best pathway involves surgical resection of operative lesions, but in many instances it just involves being a partner with the patient in the long term. Penn is a very collaborative environment of physicians, scientists, nurses, and therapists. The atmosphere here is one of calm determination to advocate for patient care. Neurosurgery is a dynamic and progressively evolving field. I think of neuromodulation, endovascular therapies, minimally invasive surgeries, all of which have really come into play in the last several years. On the neurosurgery event horizon, we certainly see a role for brain-computer chips to be an active participant in restoring or reanimating paralyzed limbs. There's also a role for more advanced endovascular therapy. And finally, there's a role for more sophisticated neuroimaging techniques that allow us to understand a person's brain structure prior to a surgery so that we maximize their outcome in the long run. I chose neurosurgery because I feel there's no more personal way to know an individual than to study how their brain stores memories, thoughts, emotions, and feelings. As a neurosurgeon, you intimately get to know these portions of an individual, and you care for them just like you would care for one of your own children. When someone has an operation, they put their full trust in you, and they will wake up at the end of the operation the same person as they went in. That, to me, is the most rewarding part about being a neurosurgeon. My name is Dr. Tim Lucas. I am a neurosurgeon at Penn Medicine.